superior collicus, like this, with this specimen is possible to mark, yes? And here you see the inferior collicus, yes? And through the inferior collicus, from this position, like the dorsal, the ventral position here, you see the nerves, yes? Which nerves? The first, from the inferior position, so this must be the trochlear nerve, yes. Here is visible the trochlear nerves. Okay, from the, maybe, this is not exactly good. Here, this one is a perfect specimen. So here, now, you see the same, but from the isolated, yes, the specimens. Here is the superior collicus. This one must be the inferior collicus. The superior collicus, coordination, what? What do you think? Here we have the retinal cells, yes, retinal. This one is the six, like the laminas with the retinal cells. So this must be the refer to the visual pathway, yes, here the superior collicus. And the superior collicus here send, what is this? What do you think?
Nerve fibers?
What? Brachium? This one, what is this? Here. The superior collicus, you see? Yes, it's visible. So the superior collicus, and this one is like the crus, like the rami, yes? So this one is the superior crus, superior rami. And this structure, the end here. So, which structure is now I marked? The lateral, what? What is this? Geniculate body. You heard about this or not? No? So you must remember the superior collicus refer to the visual pathway, coordinate your eye, yes, your visual system. Send the ramus, superior crus, yes, here, or limb, and the end, here where I marked now, so this one is the lateral geniculate body. So if this one is the lateral geniculate body, so this must be the which body? The medial geniculate body, yes. So this two body geniculate is for your least potential to pins, yes. And here the medial geniculate body join with which collicus? The inferior collicus through the limbs, yes, to the crus. So this means here we have the completely different, like the central, neural central, like the superior collicus. Here we have the inferior collicus, coordination, your hearing, yes, your hearing nerves pathway. So from your coordination, your sounds, yes. So here is the eye, here is the ear, yes. If you remember this, the inferior collicus, coordination, the hearing neural pathway, and the end here where we have the medial geniculate body join with the inferior crus. And here what we see here is the tectum. Deeply we have the tegmentum, yes, but firstly we concentrate here what we see here is, what is this? This one is the this is the frenulum, is a potential to mark, yes, the frenulum. And here is, what is this? This one? This is like the laminas. Which laminas here? The superior medullary laminas, yes, covered the rhomboid fossa. And here is, you see, now it's visible, yes. So all of this, what you see now, is a rhomboid fossa. Which part of the rhomboid fossa forms, maybe this part of the rhomboid fossa forms the four ventricles boundaries, yes? But which part? Which one? Here we have the rhomboid fossa, yes? So where is the visible? No, I can see. Rhomboid fossa is a inferior and the posterior part of the fourth ventricle, yes? Yes. So here you have the structure of the fourth ventricle, and from the rhomboid fossa you have the position of the nucleus of the cranial nerves. So here you have the middle eminence, you see, like the middle eminence of the rhomboid fossa. Here we have the middle sulcus. This sulcus is exactly the place where the end, which structures the cerebral aqueduct. Here you have the cerebral aqueduct. The cerebral aqueduct, the end here, forms the middle sulcus, and this sulcus, middle sulcus, is continued through which structure? Through the medulla oblongata. Yes, here you have the medulla oblongata. Here we have the obex. Yes, this structure is called like the obex. So the obex control the outflow of which fluid? The cerebrospinal fluid. Yes. Where originates the cerebrospinal fluid? Who remember? Who knows? From the ventricle. And maybe during the written question, written test, is all ventricles produce